The broadcast is now starting. All attendees are in listen-only mode.
Go ahead, Dr. Lancman.
Okay. Good evening, and thank you all for joining the webinar. I'm going to be presenting our book entitled What You Need to Know If Epilepsy Has Started Your Life, a guide in plain English. And this book is written approximately like 2 years ago, and it was the work of a team of doctors, and you can see some of the authors. Myself, Marcelo Lancman, Oli Calaban, Evan Fertig, Dr. Lorna Myers, and the nutritionist Dana Casendino. I'm going to be introducing each of the authors. I'm going to be telling you how the idea came about and some of the information that we have in the book and some things that may be of interest for you. About myself, my name is Marcelo Lancman. I'm the director of the Northeast Regional Epilepsy Group. I'm an epilepsy specialist, and for that I did my neurology training, and then I specialized for 3 years in epilepsy after being a neurologist. My training was at Wake Forest University for 2 years, and then at the Cleveland Clinic Foundation for another year. And again, my current position is medical director of the Northeast Regional Epilepsy Group, which was founded in 1998, and I was one of the founders of the group, so I've been working with the group since then. I'm also the medical director of the epilepsy programs at Hackensack University Medical Center, Overlook Medical Center, and White Plains Hospital, which they are 3 level 4 epilepsy centers. I have 30 years of experience as a doctor and 25 dedicated to the treatment of epilepsy. I'm also a co-chair of the Association of Private Epilepsy Centers, the Consortium of Private Epilepsy Centers, a member of the New Jersey Epilepsy Task Force with Governor Christie, working on different aspects of epilepsy issues in the state of New Jersey, and also a reviewer of different scientific journals. The main reason I want to introduce myself is just to express that I have dedicated my life to epilepsy, and I'm trying to convey all my learnings and experiences in this book. The other authors, the co-authors that collaborated with me are Dr. Oli Calaban Grant. She trained in epilepsy at New York University, and she's the associate director of our epilepsy group. She's also the medical director of the epilepsy program at White Plains Hospital. She's the director of the Women's Issues in Epilepsy for our group. So she brings a significant amount of experience in women's issues and many other aspects, but that's her main area of interest, and she had a great collaboration and part in the book in that regard. The other collaborator is Dr. Evan Fertig. He trained in epilepsy at Yale University. He is currently the director of research for our group, and he is also the medical director of the epilepsy program at the Jersey City Medical Center. And Dr. Fertig brought to the book all his experience at Yale as an attending there, and then working in our group for many years now and directing the research. He brings a lot of expertise in research for epilepsy. The next collaborating doctor is Dr. Lorna Myers, who is a psychologist, a PhD, with a special expertise in neuropsychology. She's been practicing psychology for 11 years in New York. She was until recently the director of the clinical neuropsychology unit at our group, and now she's director of also of the psychogenic non-epileptic seizure program, a co-director of Epilepsy Lifelinks, and executive director of Epilepsy Free Foundation, which is a foundation dedicated to help people with epilepsy. And Dr. Myers brings her expertise in all areas of psychology, including memory, attention, depression, anxiety, and epilepsy, and episodes which are non-epileptic in nature. So it's a wide variety of expertise that she brings to and expresses in the book. And the last collaborator is Dana Casendino. She's a nutritionist, specializes in epilepsy, and collaborated in the chapter of nutrition and diet therapy for epilepsy. The question where we decided to write the book is why another book is there so many? And that was probably 4 or 5 years ago with one of my colleagues. They mentioned to me that all the patients are asking, please, can you give us some information that we can understand? And so she talked to me and convinced me, and other patients really convinced me of the need to develop a different book, a book that would be written by people who really work every day in the area. Like we have 3 epilepsy specialists, a nutritionist, and a psychologist, and would represent the philosophy of our group in the way we diagnose and treat patients. There was a need of a book very updated with information, but at the same time, many patients of my patients expressed that they couldn't understand available big books because they were too technical, and there was a need for a very complete and comprehensive book that most people can understand. So that's what we tried to do. We worked really hard, more than 2 years, and we went through many edits and re-edits. And the book was written with a lot of enthusiasm and energy to try to convey all our knowledge on all what we wanted the people with epilepsy to know in a very, very simple way that anybody, regardless of the level of education in terms of epilepsy, that they would understand it. And the philosophy of our group in terms of the treatment of epilepsy is that it's not just a medication, but the treatment of epilepsy has to be more than that. It has to be a holistic approach where the body and mind are treated as a unique whole and not as 2 independent things, or as medication and that's all. So we spend a lot of energy trying to underline the importance of not treating only with medication, but use all the things available. That could be complementary therapies, sometimes psychotherapy, diets, different things that could help the people with epilepsy. How is the book organized? The book has 5 parts. Part 1 is called A Search of Electrical Activity or Electricity to the Brain. It goes over all the concepts of epilepsy. Number 2, epilepsy treatments, and we try to touch on all the available treatments and in the most complete way. Number 3, living well with epilepsy, and I'm going to go through that in the issues that are specific for different populations and things that people need to know to deal with epilepsy. Part 4, you can do it, which is the conclusion. That in spite of all the difficulties, you can live a completely normal life. And we go through that. And number 5, some appendices with some information that could be useful. So I'm going to go one by one, not trying to express here, convey all the information of the book, but to try to explain what is important that we think is important for you to know. So the part 1, epilepsy, and what is epilepsy, and we define it in a different way so people can understand it very clearly. And epilepsy is a unique disorder characterized by seizures, which are uncontrolled waves of electrical activity oscillating through the brain, which is an electrical tsunami swamping the delicate tissue that controls every aspect of the body and mind, houses our memory, and makes us one of a kind. In chapter 1, we talk about different things. One is stages of the seizures, the aura, which is what usually precedes the seizure, but not every patient would have an aura, and sometimes an aura could not lead into a seizure. And then it comes the actual seizure that could present in so many different ways, and we try to explain all the different ways that the seizure could present. And after that, the post-ictal phase, which is what happens after the seizure. And how do people feel after the seizure, how long it takes for recover, and are the headaches associated, other things associated, and we go through all the details. Then we touch on classification of seizures, and essentially the seizures are divided in two main groups, partial seizures and generalized seizures. Partial when they start from a specific part of the brain, and generalized when they start from all over the brain. And there are so many different types of seizure. It's so very important because the type of seizure will determine the type of epilepsy, and the type of epilepsy will determine which treatment we use to help our patients. And then number 3 is non-epileptic seizures. And non-epileptic seizures, you may ask why I'm talking about non-epileptic seizures in an epilepsy book. And just because these seizures, they look very much like epilepsy, and many times it's very difficult to tell apart if they are epileptic or non-epileptic. And 20 to 30%, meaning 2 or 3 out of 10 patients that come to us with a diagnosis of intractable, difficult to treat epilepsy, they end up not having epilepsy. They have non-epileptic events. And non-epileptic events could range from different categories. For example, people with stress would have psychogenic non-epileptic events. Hello? There are type of non-epileptic events. For example, people that have low sugar, they could go into a seizure which is non-epileptic, or people that faint, they faint and then go into a convulsion which is non-epileptic in nature. Then we touch on what causes and who is at risk of epilepsy. And first we discuss the seizure threshold concept, and that is extremely important. What is a seizure threshold? Why some people have seizures, why people don't have seizures, and we go through all the factors that would affect that could throw the threshold to the other side and for someone to have a seizure. Then we go through the common causes of epilepsy, and we touch one-on-one in detail. Genetics, head injury, having a stroke, a brain tumor, an infection, brain malformation, metabolic disorder, degenerative disorders like Alzheimer's disease, perinatal factors, things that happen around birth, and all one by one, what could cause epilepsy, and sometimes we end up not knowing. But, you know, with the techniques and technology that we have now, we end up more and more knowing more why someone would have epilepsy. The other important thing is seizure triggers. And when we mention the threshold, there are things that could throw that activity on top of the threshold and have the seizure happen. And those are things that are extremely important to know for people with epilepsy because they will need to be avoided. Alcohol and some drugs, stress, changes in temperature, lights, mainly flickering lights, fever, illness, hormonal changes, sleep deprivation, extremely important, need to sleep very well. That would help the seizures a lot. Hyperventilation, when someone is exercising a lot, needs to take breaks. Medication and supplements, there are many medications and supplements that could cause seizures, and many times you're probably trying a complementary medication or a herbal medication that you think would not cause any problems, that could cause seizures or could help. But that you need to always to talk to the doctor. It's very important to understand that that could trigger seizures too. And one of the most important ones is missing medications. Chapter 3, diagnosing epilepsy. How do we diagnose epilepsy? And we go through the history and the physical exam. We do some testing. We get some blood work. We get an EEG, which is an electroencephalogram. Some wires that we put on the scalp to pick up the electrical activity, which is going to tell us where the seizures come from, whether there's seizures present or not. Imaging, like a CAT scan or MRI. And then we touch on epilepsy classification, and again, epilepsies are divided into partial and generalized. Partial when they start from one part of the brain, generalized when they start from all over. Idiopathic when we don't know why, and symptomatic when we know why. And why is so important to know which type of epilepsy we are dealing. It's just that the treatment is going to be different for each kind of epilepsy. Each type of epilepsy will have a specific treatment. So if we don't know, we are not going to help. So we need to know, your doctor needs to know which type of epilepsy you have. And then we go through chapter 4, epilepsy symptoms, and we talk about each one one by one all the syndromes that type of epilepsy. Syndrome means epilepsy types and groups that go together, that they have a common way in which they behave and they are treated. So it's important to know them very well so the doctor can advise you. And different syndromes happen at different ages, so the book goes through all the ages, age groups, and different syndromes that happen in each age group. And then the part 2, epilepsy treatment. And probably that's what most people are interested in, how do we treat and how do we help control the seizures or cure the epilepsy. And there are different steps. One is finding the right doctor for you. And there are many things. You need to look into the training. Is that a general doctor or is a neurologist? If it's a neurologist, is that a neurologist with epilepsy training called an epileptologist? And if it's an epileptologist working with a group of other epileptologists, or it's one epileptologist that is in a group of neurologists and may not be able to provide you, 24/7 coverage. So that's something that the book explains and tries to guide you through. And different type of doctors, so you can learn what are the qualifications you need to be looking for. And also, then it's personal to you how you feel in terms of the chemistry. And they will go through many examples of questions that you may want to ask your doctor about the epilepsy. Then we touch on medications, and there are so many medications, so we need to choose which medication is right for you. And that will depend on many things: the type of epilepsy, the side effect profile, the general condition of the patient, and the cost. So that is well explained in the book, and it's a combination of what weighs more to choose the right medication for each person. And then what happens to the medication in the body, how the medication is absorbed, how it goes through the bloodstream, and how does it get to the brain, and then how it's eliminated. And you learn all those steps. The next important question, which we ask all the time, is what is a generic medication? And the book explains what is the difference with a generic medication and brand name, and why it's important to use one or the other, and what are the benefits and the problems of each one. The other question that is explained is, when do we start and when do we stop treatment? Is that one seizure enough to start treatment, or we need to wait for more than one seizure? The other question, how long you need to be seizure-free to stop or to taper off medications? You stop them or we taper off? So there are so many questions that we try to answer. And then we go through each medication. We talk all about each medication. Then the next chapter is surgical treatment of epilepsy. So many patients that don't respond to the medical treatment, to the medications, could be candidates for surgery. To be candidate for surgery, two things should happen. One, all seizures need to come from one part of the brain, and you do many testing to localize, and like video EEG, MRI, PET, MEG, SPECT, and that is well explained extensively in the book. And then what are the tests that you do to make sure it's safe to remove that part of the brain? And you see neuropsychological testing, WADA tests, brain mapping, functional MRI. There are different types of surgeries. You see lesionectomies when you remove a part of the brain, non-lesional resections when you remove a part of the brain that there is no visible lesion, there is no tumor, nothing, so you have to go through the electrical activity. Other surgeries are lobectomies when we remove a lobe. Hemispherectomy means removing half of the brain. Corpus callosotomy means splitting the two halves of the brain. And multiple subtial transections, which is a different kind of epilepsy surgery. So I don't have the time to go one by one, but you can find a very detailed explanation if you're interested in surgical treatment. The people that are good surgical candidates, they could have very good outcomes. If someone has like temporal lobe epilepsy, and they could have 60–70% chance of becoming seizure-free, and depending on which type of epilepsy you have, that's why it's so important to know that. And then there are stimulators. It's the vagus nerve stimulator. We talk about that, and the NeuroPace, which is an implanted stimulator in the brain, which is something new now available, recently available, and we discussed that. Chapter 8 talks about diet therapy. In general, wanted to avoid stimulants like caffeine and any kind of stimulants. And we touch on the main three anti-seizure diets: the ketogenic diet, the modified Atkins diet, and the low glycemic index diet. And those diets are not for everybody, but for the people that qualify, they could be of extreme help. And an extensive discussion is presented in the book. Chapter 9, supportive and complementary treatments. Extremely important always to work with your doctor. I have so many patients that come with supplements that they take that they think that is fine, and the supplements and the herbal medicines, they are medicines, and they have things that could affect seizures. It's very important always to discuss it with your doctor. There are supportive therapies like psychotherapy, art therapy, cognitive remediation therapy, which is a treatment for memory problems that we do at our group, and support groups to support in social ways for people with epilepsy. The complementary treatments, we have herbs, and we go through almost all of them, many, and what are the pros and the cons, and supplements like vitamins, minerals, amino acids, and hormones. They all play a key role in epilepsy and and help or interact somehow with medications that we use to treat epilepsy. So it's very important to be very aware of that. And other treatments that increase relaxation include aromatherapy, autogenic training, massage, meditation, music therapy, neurofeedback, progressive muscle relaxation, and yoga. And then we have the non-traditional medicine, acupuncture, homeopathy, hyperbaric oxygen therapy, neuropathic medicine, traditional Chinese medicine, and we discuss that one by one in detail in the book if you're interested. Part 3 of the book, Living Well with Epilepsy, and here we go to special medical topics. Men's issues, there are specific issues that are for men. Some of the epilepsy or some of the seizure medications could affect fertility or sexual drive and different other things, and we go through that in detail. Then women issues, there are many. One is a catamenial seizures that happen around the menses, which is very common. Birth control pills, how they affect or they could be affected by seizure medications. What happens with menopause and what happens with osteoporosis. Then we touch on things related to the elderly, and there is a lot of information which explains how this is so different from the rest of the epilepsy population and the precautions that we have to take. Then we touch on emotional and cognitive problems, anxiety, depression, and memory problems, which sometimes could be very common in people with epilepsy because of different things. The epilepsy could be associated with anxiety or depression, so sometimes could affect the memory centers, or the seizure medications could cause anxiety or depression or affect memory, or the fact that someone has epilepsy may make them feel depressed because they are limited and cannot do other things. And there is treatment for this. It's extremely important to recognize it, and we give some guidance how to recognize that. Chapter 11 goes over pregnancy, before, during, and after, how you need to prepare, what complications may happen, how to protect the mother, how to protect the baby, can you take seizure medications or not, before you get pregnant, how you need to prepare the delivery. You can have a regular delivery, or you have to have a C-section. So those are the questions that are answered in the book, and how to take care of the baby. Then chapter 12, practical issues, and we talk about seizure-related emergencies. Status epilepticus, which means when seizures get completely out of control and they don't stop, and that could be a very serious situation. We touch on sudden death, which is a bit higher the occurrence in people with epilepsy than without epilepsy, and we try to touch on which people could be at greater risk and what to do. Driving and transportation, which is extremely important for people with epilepsy, since many states, most states, or all the states have limitations in driving for people with epilepsy. Safety, how to be safe at home and how to be safe everywhere, how to prepare, traveling, how to prepare when you travel, exercising and playing sports. One by one, we go through each sport and which one you can play safely, which one you should not, and which ones you could with the proper precautions. In chapter 13, we talk about the epilepsy and the workplace, choosing a career, interviewing, should you disclose or not your epilepsy, and seizures at work, what you do if you have a seizure at work. And we go through all these and give you some guidelines and some opinions on how to approach these important items. Chapter 14 talks about the legal issues. What happens if you ask to leave the movie theater, for example, after a seizure and you don't want to? Do you have the right to stay or not? If you get arrested because you have a seizure that the policeman didn't recognize that was a seizure and they think that you're drunk or something else? What happens if you are denied health insurance? And what happens when you have financial distress because everything is very expensive? So we touch on everything and try to give you some guidelines to that. Chapter 15 talks about coping strategies for families and friends and how to care of someone with epilepsy. And it's very important not to focus only on the patient, but also on the family, which is key for the successful treatment of the patient, and all the support that the patient needs and how the family can support and can, in a healthy way, keep functioning and working to help the person with epilepsy. And the last chapter, you can do it. You can live a normal life. And in spite of all the obstacles, and sometimes there are many, many, in my experience of 25 years of seeing patients with epilepsy, I can say that most of my patients can live a normal life. And there are many, many limitations. There is no question about that. If you cannot drive, you cannot walk, there are so many limitations. But the attitude is extremely important. If you can overcome the limitations with a positive attitude, you can have a normal life. You can try to have the best possible life and make a great thing of your life. The part 5 in the appendices, we talk appendix 1, epilepsy resources, a lot of resources. Number 2, seizure-related driving regulations by state. Number 3, an explanation of the symptoms of each partial epilepsy by law. And number 4, all the medications that could cause seizures or epilepsy. So we've been selling a lot of books in the last several months, a couple of years. And what do we do with the monies that we get? All the royalties earned by, from these book sales are donated to the Epilepsy Free Foundation to support summer camps and continuing education scholarships for college granted to people with to persons with epilepsy. So whenever you buy this book or you give a donation to Epilepsy Free, you know that it's used for summer camps and scholarship for college for people with epilepsy. And I have to say that all the collaborators as well as myself agree that to do that forever. Dedication, really want to dedicate this to all our patients, to all the people with epilepsy, and to our team, which works so hard to support people with epilepsy all the time. Where can you find this book? You can go to Amazon.com, BarnesandNobles.com, and hopefully you can share the information and write to us and contact us and give us all your feedback, and so we can improve the next editions, and we can improve the approach in how we treat people with epilepsy. Okay, thanks very much for your attention, and hope to have a chance to communicate with you again. Good night.